Hi, my name is Modoni Monica. I'm a BSN, RN, RH practitioner, and today I'm going to talk about the menstrual flow or the menstrual cycle. A lot of young girls and women have come to me asking me to talk about the menstrual flow. Let me start by saying the menstruation or menstrual flow, or what they call the periods, is not something to be ashamed of. It's not a curse. It is something natural, and it's a natural process in a woman's body. It is not uchafu, and it is not something that any woman is supposed to be ashamed of. So every month, a woman has a set of hormones that control that cycle. In the reproductive organ of a female, there is the ovaries, the fallopian tubes, and then we come to the uterus, or what we call the womb, where the fetus or the baby is held for 9 months. So every month, the hormones mature one of the ovaries. There are like 1 million ovums in every ovary. So every month, one ovum matures and it moves to the fallopian tube, where it gets fertilized and then travel again to the uterus, where it is embedded and the baby is nurtured there for 9 months. So every time of the month, when this egg is maturing and moving to the fallopian tube, the uterus is also being prepared for it to be able to host or to hold the baby or the fetus for the 9 months. So what happens? The uterine lining is called the endometrium. So this one thickens, and it thickens, whatever thickens it, it's blood and tissues. So that when the baby comes, the baby is cozy and is very comfortable inside there. So when the egg is not fertilized at the fallopian tube, the egg lands in a very cozy environment, in that cozy environment. Then the uterus realizes this ovum was not fertilized. So what happens? It tells the uterus, now it's time to shed this lining, because we don't need this lining because there is no baby to nurture. So the uterus contracts and removes the lining. So it sheds this lining that it had made for it to be able to host the baby for 9 months. So whatever is shed is what we call the menstruation or the menstrual flow. And this is what people call uchafu, of which is not uchafu. This is blood and tissues. So at this time of the month, we need to protect ourselves, because this could maybe stain our clothes or stain where we are seated, and it's going to be uncomfortable to us women. So at this time, we will either need something to protect us. This is something like a pad. We could use a tampon, or you can even use a menstrual cup. And all these things that you will choose to use as a woman, you need to use something that is hygienic. If you're choosing a pad, choose a pad that is made with natural, 100% natural material. And when I'm talking of natural material, this material should be absorbent. It should absorb all the blood and the tissues, so that blood is not left at the top. Because when blood is left at the top of the pad, when it's not being absorbed, what happens? Your vaginal area is going to be very wet with blood. Remember, blood is a very good medium of bacterial growth. So when you are wearing a pad that is not absorbing the blood and the tissues, what happens? So you're having blood on the top, you're having your vaginal area which is warm, and now blood that is a good medium of bacterial growth, and the warmth and the dark inside there, then bacteria grows. And that is why many women will complain of infections every time they are having their menstrual flow. After or within, they will talk about a bad smell. It is always important to have a pad or a tampon, or if you're using a menstrual flow, you need to a menstrual cup. You need to be emptying your menstrual cup and making sure your hygiene is of high notch. We can prevent ourselves from getting these infections if we use the right pads. The other thing I will tell women, it is we need to take a bath when we are having our flow. And it is not only when we are having our flow, we need to take a bath at least twice, because of how our vagina or how we are created as women. When we are wiping ourselves, and especially during the menstrual flow, kindly, it is very important to wipe from front to back so that you don't also get the bacteria from the anus to the vagina. This is very important. Now, when the uterus is contracting so that the uterus lining can be shed, women will experience a bit of pain. That is what we call contractions, what we call spasms when the uterus is contracting. This time, we need to tell our girls it's important to at least take our mind off the pain and do something else. Let us not just sit and listen to that pain, because if you listen to the pain, the intensity of the pain is going to continue because you're concentrating on the pain. So when you're having your periods, it's important to keep yourself busy. If you don't have anything to do, take a walk. If you have something to do, clean the house, do something, concentrate on your studies. This way, you will take the concentration of the pain and you might not feel that pain as much. If the pain is too much, you can use a hot water bottle and place it below at the lower abdomen, and this may help relieve the pain. If the pain is too much, again, you can take some antispasmodics, but it is not advisable to take drugs. If it goes beyond, kindly seek medical advice.